Good morning to you all. Welcome to the second segment of the talking station, communication skill station. Right, so what we are going to do is, we have already given the case for the candidate. While he is reading and preparing, I will do a brief introduction about how the case goes. And after that, we are going to run the mock exam, where Professor Shamila will be the lead examiner. And after the examination, she will give a feedback, and if we have time, we can take one or two questions. Right. Okay. So, as opposed to the OHT, in communication skills, in OHT it is getting information, and in communication station it is giving information. So for that, the candidate should have a very good idea about the scenario before the encounter with the surrogate. And more than in OHT station, the handling emotions of the surrogate plays a big role in this segment of the exam. Right, so you know there are three groups involved in the exam: examiner, candidate, as well as the surrogate. So Dr. Sujanita explained this, so I will quickly go through this so that you will remember more. So you have 25 minutes altogether, 5 minutes outside the room and 20 minutes inside the examination room. So during the first 5 minutes, the candidate will give the case and he will go through the case, and at the end of the 5 minutes, the first bell will go and the candidate comes to the room and he will meet the surrogate. So in the other side of the exam table, two examiners will be observing the whole procedure. So at 12 minutes, so you have 14 minutes to spend with the surrogate. So at 12 minutes, one of the examiners will give an alert about the time, that only 2 minutes is left. And at 14 minutes, the surrogate will leave the room, and we will give 1 minute to organize the thoughts. So at 15 minutes, so we will, at 15 minutes, we will start the examiner. Usually one examiner interviews, and it will be only 5 minutes, and after 5 minutes, the examination will be over. Right. So these are some of the scenarios you will get. Breaking bad news, giving information about the disease, about a disease or a treatment, obtaining consent, accepting an error, giving sensitive information, motivational change, and some ethical scenarios. Now, what do we expect from you during the 14 minutes with the candidate? Now, you have to identify the task clearly. Sometimes there may be more than one task. And rapport building with the surrogate is very important. And initially, you need to get few information from the patient, but you should not get a detailed history. And after that, you have to give information properly, clearly, and while doing so, you need to check understanding, which is called chunk and check. And identifying emotions of the surrogate, and then you have to respond to the emotion as and when they come, and you have to identify the I's, that is ideas, concerns, and expectations. And after that, you have to negotiate a plan of management with the surrogate. And at the end of the exam, you should have an insight regarding how the consultation went. Right. Now, what are the qualities of a good candidate? And a good candidate should be confident and competent and should have a proper tone of voice during the consultation and should use appropriate verbal cues and pauses and use simple language, and you should avoid medical jargon. And you have to always show sympathy when necessary, and you have to be kind, compassionate, and you need to handle emotions as they come up. And you need to answer and then negotiate with the patient and always be truthful. So my last slide is what you should avoid. You should not be too mechanical, right? So that is one thing you should avoid, and you should not use medical jargon. You should you should not ignore emotions, and you should inform in the management plan without discussing and negotiating that you should not do, and you should never give false hope for the patient. Right. So now this is the case we are going to discuss. Yeah, you can come.
Good morning. I'm Dr. Nirujan, doctor from the medical clinic. Just for verification purposes, may I know your name and date of birth?
Yeah, I'm Kanti Gunawardana, and I'm 55 years old.
55. So how are you feeling today, Mrs. Kanti?
A lot of pain, doctor, on my back. Yeah.
Okay. Mrs. Kanti, how many children do you have?
I have 3 kids.
3 kids.
Yeah.
Okay. Are you occupied or?
I'm involved with so much of housework, doctor.
Okay. You're a housewife.
Yeah.
Yeah.
I'm retired teacher.
Okay.
Yeah, but.
Yeah. Just to recollect the thoughts, is it a good time to talk to you now about the?
Yeah, of course, doctor.
Okay.
I wanted I know I need the results, so I'm here for that.
You know the purpose of the visit, yeah.
Yes.
Do you want to have anyone else with you
No,
during
it's
the
okay,
discussion?
doctor.
Or
It's
you are
okay.
okay with that?
Yeah,
Okay.
of course.
Yeah, moving on into your the symptoms. Can you brief me what exactly you had, what was troubling you?
Well, doctor, I started with a back pain for the past 3 months or so.
Okay.
And I've been trying, I've tried various things. Finally, I went and got some painkillers.
Yeah.
And it hasn't helped at all. And these doctors keep taking test after test after test. And I don't understand why they're doing so many tests. Why can't they give me, some tablet to ease off the pain?
Pain, yeah.
Yeah.
So what about your pain with the tablets? Did your pain improve or?
Not really. They haven't given me,
Okay. Should have been offered. What do you think the reason for the pain is in your mind? Do you have any ideas?
I think with the work I do at home, maybe that's the reason why. I'm involved with housework, cooking, then it's a case of cleaning up the garden and, attending to all of those things.
You're thinking that's mainly the cause.
Yes.
Do you have any other concerns or any thoughts about the reason for the pain? Anything crossed your mind?
Not really, doctor.
Not really.
No.
Okay, that's fine. Okay, have anyone told you about the investigations or the tests we have done or anything about your
Yeah, they got
disorder?
me to do some, they said it was a bone marrow test. It was painful, doctor.
Painful.
Yeah.
So, did anyone discuss about the results of those tests?
No, I
with
think
you?
I'm
Not
waiting
so
for
far.
that. That's the main result that I'm waiting for.
Okay. So, what exactly now you might be knowing that I have the test results with me, and
Yes.
the purpose of this is to discuss with you.
Yes.
Before moving on into that, what exactly do you like to know? Because some people do not want to know what the disease they have, and some people want to extensively discuss things in the first visit. Some might want to take a couple of visits. They might want to involve the family as well. So, what exactly would you like to?
I want to know
me
everything, doctor, because as long as I can get rid of this pain, I want to know everything.
Yeah, I understand.
Yeah.
You must be going through a huge lot of pain.
Of course.
It must be. Okay, Mrs. Kanti, I'm afraid that I don't have any good news with the reports.
What do you
today.
mean, doctor?
I have your bone marrow
Okay.
reports as well as the other tests we performed in your blood.
Okay.
I'm sorry to say this, but the tests confirm that there is a cancer involving your bone, which is possibly
Are you
a blood
sure,
cancer.
doctor? Are you sure?
I'm sorry, but Yeah, we've gone through the reports and it's confirmed. I can feel that it must be a huge Can I get you some tissues? Or?
Yes, please.
I can see that, Mrs. Kanti, it must be a huge shock for you.
Yes, doctor.
How do you feel now?
Will I live, doctor? That's what I want to know.
Do you want me to proceed with
Yes.
further details? Okay?
Yeah.
It's perfectly fine. If you want some time, we can wait.
Will I live, doctor? That's what I want to know.
Yeah. So this is basically a cancer which originates from your bone marrow, the inside part of the bone, which produces blood cells. So that is basically what our results have confirmed. And certain blood tests we have performed on you, says that the outcome might not be very good, but yet we need to perform certain other tests to see how far the cancer has proceeded, so to decide on the management. Up to this, do you have any concerns, or do you want me to clarify anything regarding whatever I have told you so far?
So, there's no good outcome out of it?
Yeah, I can understand your concern. It's like this. I'm afraid I'm not a specialist to answer all the questions, but my limited knowledge, we cannot say anything before we stage the disease. That means we do certain investigations, certain CT scans, and certain blood investigations to see how far the cancer has proceeded. And but definitely we'll be arranging an appointment with doctors called hemo-oncologists, the doctors who are specialized in these cancer areas. So they'll be carrying on with the further investigations. But that doesn't mean that we are going to let you down. We'll be also following you up. I'll be arranging appointments for that. And just to ask you, have you known or have you come across anyone in your family or in your vicinity with these sort of cancers called multiple myeloma? That is what you have, the report says, multiple myeloma.
No, never heard of it.
You haven't heard about
No,
even in the internet, you have not come across a term called multiple.
No.
Yeah,
What's it about, doctor?
Yeah, as I told you, the test says that you have multiple myeloma. It's the cancer which arises from the bone marrow, the inside part of the bone, which produces blood cells. So, would you like me to take you through the other treatment options as
please,
well?
doctor. No, I need to know what, I need to prepare myself and my family. So if you can tell me, what I'm supposed to expect.
Yeah, exactly. So there are several treatment options which will be decided on the patient's factors and the stage of the disease. But overall, there's no permanent cure, to be honest with you, for multiple myeloma. But there are options which give a very promising, hopeful outcome as well. So certain patients are selected for a treatment option called bone marrow transplant.
Okay.
Have you ever heard about that?
I've kind of heard about this thing.
Yeah. So that the hemo-oncology doctors will decide. So depending on the investigations. So that is one option. But in the meantime, everyone will be put on a drug regime called chemotherapy. Have you had any?
I've heard about all of these words, but I don't know the procedure or anything like that.
That's perfectly okay. So they'll be starting on certain drug regimes, and if your pain, for the pain, we'll be referring you to the pain specialist doctors who have excelled in this pain management, and we'll be also starting you on painkillers, but we have some concerns. There's already some renal damage, kidney damage going on because of this.
Doctor, I did a test about 8 months ago, so they said there was nothing. They said I'm healthy.
Yeah. I can understand that it's normal for a person to be upset about it, but being honest with you, sometimes multiple myeloma, this sort of cancers can come out of the blue as well. So maybe before 8 months it would have been normal, and with progression the kidney damage will occur. So that may be one reason.
So where do I have to go? What do I have to do next, doctor?
Yeah, we'll be arranging the appointments as early as possible. I'll speak to the relevant consultant and through my consultant, and I'll arrange it as soon as possible. Most probably you'll be getting an appointment within the next 2 weeks. I'll make sure that you get an appointment.
So I do the treatment in this hospital?
Currently we have a specialized hospital at Maharagama, so
Okay.
you may have to go there and get the treatment done.
Okay. And would I have to spend a lot of money, doctor, for this?
No, actually, most of the drugs are available at the government sector, but for the time being, I'm not very sure whether certain drugs are not available due to the prevailing country situation. I'm sorry, I cannot exactly answer that part, but usually we do have all the available drugs here. If you want, I can check it with the doctors there, and I'll let you know.
So I'll be having to go and find my way there, or how does it happen?
Yeah, we can even arrange an ambulance for you if you want to transfer you to that hospital, but you have to get admitted if you are prepared for that.
Okay. So would you all introduce me to somebody there, or do I have to go and find?
No, we'll introduce you to the unit. We'll give a letter written to that doctor.
Okay.
And moving on to the pain which you're suffering
Yes,
from,
doctor.
we'll be, as I told you earlier, we'll be referring to the pain doctors, and we'll be starting on painkillers.
Yeah.
And there is other option. We can, if the pain is not responding, we can. Okay, ma'am. We can even go for radiotherapy to irradiate your bones, so that might help. But they will decide on that.
Okay.
And for the kidney problem, we'll be also involving the nephrologists, the doctors who have specialized in kidney issues. To summarize, can you please tell me what you have understood so far in the discussion?
Yeah, so it's not very good. And that I have a cancer in my bone marrow.
Yeah.
And I'll have to take medication for it. And you said it's not very good, right, doctor?
Do you have any other concerns for me, doctor? So any other questions which I can answer?
Because I have a daughter who's unmarried, and my only desire is to see her married off. And
you have any marriage plans for her fixed in the future, or?
Well, at the moment, no. She's only 21, so I was hoping that I'll be able to keep her in marriage, and those are the mother's dreams. So yeah, it's heartbreaking to know that I won't be able to kind of be there.
Mrs. Kanti, I'm afraid we cannot exactly tell a particular duration of survival, but it depends on the stage as well, and I'm not an expert in that field, but it depends on the stage. But if it is an advanced one, usually the survival they talk in years. About the 5-year survival for even an advanced one would be 55 to 70% of survival. So what I can say is, if you can arrange the marriage as early as possible, it would be also would be a good option.
Okay, thank you, doctor.
Thank you.
Thank you. You
have 1 minute to gather your thoughts and then we will discuss. Okay, let's start. How do you think that encounter went?
Basically, it was a middle-aged female who was active housewife, mother of three, who has presented and extensively investigated for a lower back pain. And unfortunately, the recent investigations has revealed multiple myeloma. And so this was to unreveal the truth, and I was honest with her, and the diagnosis is confirmed. So during the initial consultation, she was going through the grief reactions. There was not much of a denial, though, which I could not appreciate, but she was down. That's a normal grief reaction, which I appreciated. But yet, despite that, she wanted to proceed with the diagnosis and the further management options. And during the history, I was able to elicit that she was concerned about her daughter's wedding.
Okay. Now, you think from your performance, I want to know what you think about your performance, how you handled the situation.
Yeah.
Do you think you handled her responses and her grief and her sadness well?
I think so, madam.
You think so? Okay, okay, right, okay. I mean, as
Yeah.
understandably, she was devastated to hear the
Yeah,
news.
madam.
So you think you handled the situation fairly well. What was her idea about her back pain?
She was basically attributing it to the day-to-day activities, madam. It was because of the strain which she has. She never had the idea of cancer, malignancy in the back of the mind.
What was her concern about her disease at the diagnosis?
At the outset, her concern was that she has been channeling so many doctors, but they have been performing so many tests. None of them have told her about the diagnosis, and the pain was not responding either. So that was the concerns at the outset, madam. So then I told her that.
Subsequently, she gave you another concern. She talked about another concern subsequently.
That was about her daughter's marriage. madam.
Daughter's marriage.
She's
How
21.
do you think you handled that problem fairly well?
She didn't exactly ask me about the outlook of the disease, but then I told her that honestly, I'm not the expert to say about a prognosis and to comment about the prognosis, though the beta-2 microglobulin and calciums and creatinines are high. Maybe the prognosis may not be good, but I didn't want to commit on that at this instance until the imaging and further tests are available. So that the other option is, because we cannot exactly tell a date, then I just told her that about the survival rates which I know of, and then the other option is to take a marriage practical ways to arrange the marriage as early as possible, if practically possible.
You gave some very practical marriage advice. Yes, okay, right. So what was her expectation from you? What did she want from you?
Basically, at the outset, she wanted to have a diagnosis because she was so frustrated that, and the other would be to relieve the pain.
Okay.
That was the symptom she had.
Okay. And then she wanted something else as well, isn't it? She was talking about the disease. She wanted to know how long she had to live.
Yeah.
Can you tell her how long she has to live?
Honestly, madam, without a staging and proper investigations, we cannot.
Difficult.
So it depends on the staging. That's
you
why. You
talked about bone marrow transplantation. Do you think that's a possibility given the amount of information that has been given
with
to you?
With the information of high beta-2 microglobulin and impaired renal function, the bone marrow transplant may not be an option. I'm afraid of that. But still, sometimes they do start them on chemotherapy, and if the response is good, hemo-oncologists do consider sometimes. So that's why I told that I'm not the expert in this field, but that was an option. But honestly, that might not be the most suitable option in this one. But I didn't want to bombard her with too many chunks of information, so I
and also, give too much of bad news in one go.
She was also emotionally down with that.
Yes. So. Did you ask about any other illnesses that she has which might have an impact on this disease?
Actually, I couldn't go through her history, madam, whether she has any other comorbidities.
Do you think it is important?
That's important because she has renal impairment and the management options, because she might be started on chemotherapies, prednisolone. So if she's a diabetic, it might have
She is a diabetic. She's a well-controlled diabetic, recently diagnosed, well-controlled diabetic. So probably you should have asked a little bit of information about her past history and her current medication as well. Do you think she understood the information that you gave her regarding the disease?
Yeah, madam, because I asked her to summarize and she came up with the facts reasonably well. So the understanding was good.
Okay. Okay, I think we are coming to the end of our time. Thank you very much. Thank you. Okay, so I will just do a little bit of a few little things I will talk about, nothing very much, because Prof. Shamali has already talked about most of these things. Instructions were already given. Assessing this one, I don't think we need to talk about this because I already talked about this. I want to talk a little bit about how this station is marked in the MD. And we will relate this to the way our candidate performed as well. The introduction and the explanations. How the candidate greets the patient, puts the patient at ease, explains what he or she hopes to do, the tone of voice, non-verbal cues, pauses and pacing, thanks the patient and concludes. I think our candidate did a pretty good job with this part of the interview, because he was quite relaxed. At least he appeared relaxed. I don't know whether he actually was or not, but he appeared very relaxed. He explained at the beginning what he wanted to do, and his tone of voice was very, very nice. He was like responding to all the things that the surrogate was talking about. And he picked up all the non-verbal cues very well. He handled a very difficult situation. The surrogate became very emotional and didn't, almost started crying. And the worst thing that you could do in a situation like that would be to continue to talk without acknowledging that emotion. What you should do is exactly what our candidate did. Stop for a minute. Give the surrogate a moment to gather their thoughts, to gather their, to get over their emotion a little bit. Give a little bit of time without, just sort of barreling through and just talking. So he handled that very difficult situation very well. That's a very difficult situation to handle. In an exam, doubly difficult because two people are staring at you and wondering how you're going to handle the situation. And in real life, even more difficult to handle. Paused and paced the interview quite well, being aware of the time, except for missing that little bit about going a little bit of information about the history. I know this is not the history-taking station. We don't expect you to take a comprehensive history in communication skills, but in the context of the question that is asked, the task you are expected to perform, you have to take a little bit of history. It's important. So the 5 minutes that you spend at the beginning looking at the question, that is the time you need to think, what are the things, components of the history I should be asking. Now in this particular instance, it was important that you find out whether the patient has diabetes, hypertension, heart disease, whatever, because the way you plan out your management, who you refer to, what you do, will depend on the kind of underlying medical problems that the candidate, that the surrogate has. So that is something that you need to remember. A little bit of history is important. Thank the patient, conclusion, that was done fairly well. So I would give pretty good marks for this part of the marking. Explores present understanding, explaining in simple language, avoiding medical terms and jargon, checking understanding, effective communication. Now this also our candidate did quite well. One of the things that I have noticed as an examiner in the MD is that candidates slip into medical jargon at the first opportunity. Tummy becomes abdomen in the blink of an eye. So you have to remember that you're talking to ordinary people and not be using medical jargon as much as possible. This is something that you have to be very mindful, and one way of getting over this problem is obviously talking to actual real patients and explaining clinical scenarios, explaining problems to patients in the language that they understand. Then you will not be slipping into medical jargon. That's one thing. The other thing is, when you practice communication skills, make sure you do it, practice with people who are non-medical people, who will not understand medical jargon. This is really a problem that a lot of people have when they come to the exam. Simple language as much as possible. As simple as possible, better. Explores and addresses the patients, and so I will mark this part carries a lot of marks. The explores present understanding, how you explain things, carries a lot of marks in the exam, so I would give our candidate quite high marks here as well. Explores the patients and surrogates' concerns adequately, again done quite well, I thought, quite well. Concerns were addressed, there were multiple concerns, all were addressed quite well. Professional attitude and empathy. Now, as examiners, this is something that we can pick up very, very quickly. As soon as the candidate walks in and starts talking, we realize how professional the candidate is. That is something that you have to practice and cultivate. And empathy, I can't teach you this is how you need to be empathic. You need, that is something that it has to come from you. Empathy is something that you have to feel, but again, you can do a little bit of acting. Demonstrate adequate knowledge of the issues related to the encounter. That is where you show your medical knowledge. Now, there was a certain amount of knowledge that was displayed by the candidate here regarding myeloma, what the disease is, how it is managed, and the information that was given about creatinine, beta-2 microglobulin, why that information was important. So that also the candidate did quite well. Demonstrates good insight into the success, failure, and difficulties of the encounter. I hope you understood that was the first question I asked him. How do you think you performed? And he seemed to have reasonable insight. He seemed to understand that he did reasonably well, and he also understood that there were some limitations in what he discussed. So overall, this is the way we mark the marking categories. So I would give this gentleman a clear pass, and in some components I will actually give him excellent. So keep up the good work in the exam as well. Common mistakes. Common mistakes, not reading the scenario. Now you get 5 minutes for the scenario. The scenario takes like 30 seconds to read. Why do you think we give you 5 minutes? It is because we want you to spend that time planning the encounter. Plan the encounter. This applies to OHTs as well, and the communication skills. Plan it out. What exactly do you want to ask? For example, breaking bad news. If you are familiar with spikes, write down spikes. What are you going to ask? The spikes protocol. How you are going to handle the breaking bad news. What is the information you need to elicit? What further information? How will you break up this information that you want to give and what are the essential components that you need to cover. You are given enough paper, you have 5 full minutes, complete silence outside the room, spend that time wisely. Use that time wisely without looking up at the ceiling and feeling worried. Spend that time really wisely and plan out the scenario. It's a very good thing to spend that time constructively. Using jargon, I've talked about this before, please avoid this. Please avoid using jargon because there's nothing that gets you marked down than when you start using lots of medical jargon and then the patient starts looking confused. Lacking emotion and empathy. If you must act a little bit. It's okay. But get the feeling across and try to respond to the emotion that the surrogate is showing. It may be anger, it may be irritation, it may be anxiety, or it may be just sad disbelief and grief and sadness like our surrogate today. Identify that emotion. Take a minute to identify that emotion and respond appropriately. That is really important in the communication skills because that shows how mature you are in handling patients and different clinical scenarios. That's a massive part of your performance in the communication skills. Not listening to the patient or surrogate. There are some candidates who spend the time outside writing down a bunch of questions and then they come inside and they fire questions at the surrogate one after the other and don't really listen to the answers. Don't do that. Don't do that. Don't do that in the exam. Don't do that in real life. The whole purpose of this exercise is you have to listen. You have to listen. It is not just asking questions. It is how you listen and you take in that information that the surrogate is telling you also. So listening is really, really important too. Not pacing the interview well. So there are components that you have to cover in this interview. There's some information you need to elicit, some information you need to impart. There is a plan you have to tell. There is a sort of a long-term plan you have to tell. You have to elicit the ideas, concerns, expectations. So you have to pace the interview properly and be mindful of the time. Unfortunately, in the exam, you won't have a nice big timer like that. So it will be, the examiners are the people who will be telling you the time, 2 minutes more to go. So be mindful of the time. And then finally, there are some candidates who don't understand the whole point of the encounter. They just come in, they just talk and they just go. They don't understand what they're doing. Don't be that candidate. Now here, this encounter, it was very, very obvious. It's a breaking bad news. But then there may be slightly more difficult encounters where you had to explain a procedure, get consent for a procedure, tell somebody why they need to do a bypass or undergo a valve replacement, why they need to be started on warfarin. There are some situations which are a little bit more difficult. So spend that 5 minutes outside trying to understand what is the whole point of this encounter. So these are the common mistakes that candidates make. And of course, there's one other thing. There are some candidates who bring a piece of paper into the scenario and start writing down what the surrogate says. I would suggest not to do that because that breaks eye contact, and maintaining eye contact, your body language, turning towards the surrogate, talking to the surrogate, maintaining eye contact all the time, those things are very important. So you break all of that when you bring a piece of paper and start writing down stuff. And you waste time also. Don't do that also. That's another common mistake that candidates make. So those are some of the things that I have noticed these are some of the common mistakes I have noticed as an examiner in the communication skills and even in the observed history taking. We'd be very happy to take any questions that you have about what we have discussed so far.